Scarlet fever. Scarlet fever is a bacterial illness that develops in some people who have streptococcus throat. Uh, Scarlet fever, also known as scarlatina. Scarlet fever features a bright red rash that covers most of the body. It always includes a sore throat and a high fever. Most common age group for this fever is children 5 to 15 years of age. Although scarlet fever was once considered a serious childhood illness, antibiotic treatment have made it less threatening. Still, if left untreated, scarlet fever can result in more serious conditions that affect the heart, kidney, and other parts of the body. The main symptoms for scarlet fever are red rash. That rash looks like a sunburn and feels like sandpaper. It typically begins on face, neck, and spread to the trunk, arms, and legs. Red lines, the fold of the skin around the groin, armpits, elbow, knee, and neck usually becomes a deeper red than the other areas with the rash. And flushed face, the face may appear flushed with a pale ring around the mouth. And strawberry tongue, the tongue generally looks red and bumpy, and it's often covered with white coating early in disease. The sign and symptoms of scarlet fever also include the fever of 100.4 degree Fahrenheit or higher, often with chills. Second is very sore and red throat, sometimes with white or yellowish patches. Third one is difficult in swallowing, and large glands in the neck, that is lymph node that are tender to touch, nausea or vomiting or abdominal pain. Also often patient having headache and body ache. The rash and the redness in the face and the tongue usually last about a week. After these signs and symptoms have gone away, the skin affected by rash often peels. When to see a doctor, like when the patient having a fever of 100.4 degree Fahrenheit or higher, or tender glands in the neck or a red rash, immediately consult to a doctor. And sign and symptom that need emergency evaluation, like shortness of breath at rest, trouble breathing, like grunting or pulling in chest muscles between the ribs or nostril flaring, wheezy or raspy breathing that does not clear with coughing, rapid breathing, chest pain, inability to swallow the liquid or saliva, muffled voice or inability to open mouth fully, confusion, drooling of saliva, dizziness when sitting or standing, dehydration. Now, what are causes? Causes are mainly the type of bacteria that causes streptococcus throat infection, group A streptococcus, also called group A streptococcus. The risk factors mainly children 5 to 15 years, complications like tonsils, skin, blood, middle ear, sinus, kidney, joints affect. How to prevent? There is no vaccine to prevent the scarlet fever. The best way to prevent scarlet fever are the same as the standard precautions against the infections, like wash your hands. Show your child how to wash hand thoroughly with warm soap water for at least 20 seconds. Also, alcohol based hand sanitizer can be used. Don't Second one is don't share dining utensils or food. As a rule, your child shouldn't share drinking glasses or eating utensils with friends or classmates. Then third one is cover your mouth and nose. Tell your child to cover the mouth and nose when coughing and sneezing to prevent the potential spread of germs. If your child has scarlet fever, wash drinking glasses and utensils in hot soapy water or in dish washes after your child uses them. So that's all about the scarlet fever.